Hello, and welcome to this webinar entitled CNAMB Certification Pathway to Excellence. My name is Tabitha Kinlaw, and I'm the Senior Manager of Education and Professional Development at CCI, and I will be your facilitator. Before we get started, I just wanted to take a moment to introduce you to the education team at CCI. First, we have Dawn Whiteside. Dawn is our Director of Education and Professional Development. Of course, you see myself there pictured below Dawn on the screen. Also on our team, we have Kimberly Jones. Kimberly is the Manager of Education and Professional Development, as well as our LMS Coordinator. Also on our team is Samantha Hendrickson. Samantha is a Professional Development Associate. Now, before we get into the content, I do need to review this disclaimer. Because CCI is a certification organization, it has a role in developing and administering certification examinations to determine the qualifications of applicants for certification. As such, CCI does not require nor endorse any specific study guides, review products, and/or training courses. So what this means is applicants may prepare for our certification examinations with any educational materials that they choose. The purchase of CCI review materials is not a requirement for testing, nor does the use of any materials imply successful performance on the certification examinations. With that said, though, CCI does offer various study resources for the certification examinations, including an on-demand prep course, practice exams, and a study guide. But no study resources are prerequisites for the certification examinations. Now, let's take a look at our objectives. First, we're going to define the value of certification. Next, we'll review the eligibility requirements for CNAMB certification, followed by examining the components of the CNAMB exam. After that, we'll discuss study strategies using recommended test prep materials. We'll also explore strategies for answering multiple choice questions and conclude with discussing resources available to prepare for the CNAMB exam. So looking at our first objective, defining the value of certification. Now, there are a couple of resources noted on the screen that we would highly recommend that you review closely. The first of those is our website. You can reach that at www.cc-institute.org. And when there, you're going to want to select the page that is related to CNAMB. On that page, you'll scroll down and you'll find the CNAMB Candidate Handbook. We highly encourage you to download this and maybe even save it to the desktop of your device. You want to review this closely and refer to it often. This handbook's going to underscore some of the things that we'll discuss in this webinar, as well as give you some other pertinent information. So, is certification? Well, certification is defined by the Accreditation Board of Specialty Nursing Certification, or ABS&C, is the formal recognition of the specialized knowledge, skills, and experience demonstrated by the achievement of standards identified by a nursing specialty to promote optimal health outcomes. The CNAMB is a voluntary certification, and it validates the professional achievement of standards of practice by a perioperative registered nurse working in the ambulatory surgery setting. The CNAMB certification is accredited by ABS&C. Of certification. And you can see by this slide that there are several. First, certification allows us to demonstrate a commitment to accountability to the general public for safe nursing practice. It also serves to enhance quality patient care. Certification identifies those registered nurses who have demonstrated professional achievement in providing perioperative nursing care in the ambulatory setting. Certification also provides employers a means of identifying the professional achievement of an individual nurse. And last but not least, certification provides personal satisfaction for practitioners as well as contributes to a career path for perioperative nurses who work in ambulatory surgery. So what are the objectives of certification? Well, certification first allows us to recognize the individual professional nurse who is proficient in his or her practice. It also allows us to strengthen the use of evidence-based theory in our practice, making sure that we utilize that nursing process, allowing us to assess, plan, implement, and evaluate patient care. And certification also enhances our professional growth. It does this through continued learning and professional development, resulting in a greater depth of knowledge as well as an expanded skill set. So let's look a little closer at the CNAMB certification. The Certified Ambulatory Surgery Nurse, or CNAMB certification, is designed for perioperative nurses working in the ambulatory surgery setting who are seeking to improve and certainly validate their professional competencies. The CNAMB certification assesses the knowledge and skills of a perioperative nurse with a minimum of 2 years of clinical practice in the ambulatory surgery setting. And when we talk about the eligibility requirements in just a moment, you'll see why this minimum of 2 years experience is so important. Earning this certification, it's a mark of distinction, and it recognizes the important role nurses play in delivering safe patient care. So let's look at those eligibility requirements for CNAMB certification. To earn the CNAMB credential, applicants must meet eligibility requirements at the time of application, as well as pass the certification exam. Eligibility requirements include having a current unrestricted RN license, having that pre-licensure degree, and you can see by the examples on the screen that a BSN is not required. Candidates need to be currently working full or part-time in an ambulatory surgical setting, and that could be in a variety of areas. It could be in the clinical practice arena. It could be in nursing education, administration, or even research. Individuals need to have a minimum of 2 years and 2,400 hours of experience in an eligible role. And of those 2,400 hours, a minimum of 500 hours of those need to be in the intraoperative setting. And when we look at how the exam is structured, you'll see why that's important in just a moment. Of course, experience in a non-paid volunteer capacity is acceptable. I would also note at the bottom of the screen, you see that if an individual has earned their CFPN or their Certified Foundational Perioperative Nurse certification, they're a CST, a TSC, or they hold a military equivalent, then that minimum of 2 years becomes a minimum of 18 months. In addition to those 2,400 hours of experience, including the minimum of 500 hours in the intraoperative setting. Now, all of this information is subject to audit, and no refunds are given for failed audits. So let's look at audits a little bit closely. Information on applications may be verified. So if there's any reason to believe that any applicant might not have met eligibility requirements, or if an outside party informs CCI that an individual has not met specific requirements, then an application may be flagged for audit. In addition, a minimum percentage of certification applications are randomly selected for audit. The credentialing department at CCI begins the audit by contacting the individual in writing to obtain documentation to substantiate the information. And information may be verified by telephone, email, or letter by our credentialing department. All information that's gained through verification procedures will remain confidential, except in instances where the law would demand disclosure of facts. Verification may include, but it's not limited to, an employee verification form that a current manager, supervisor, or human resources representative must complete. Verification of an applicant's RN license. Verification of professional nursing history through contact with past employers if needed. And the applicant is responsible for furnishing any information missing from an application or needed for audit. If any information on the application is found false, then the applicant would be notified and declared ineligible to continue in the certification process. Delayed submission of documents or submitting incomplete documentation could result in a shortened testing window. So it's important to abide by timelines. An email is sent to the applicant detailing the results of the audit after all documents have been reviewed. Failure to comply with audit requirements by the 30-day deadline or to successfully pass an audit would terminate one's application. And again, no refunds of that application fee paid will be provided to individuals who do not successfully pass their audit. So let's look at the application process a little bit closer. You can see a visual of that on the screen there. This is also available on our website. Applicants may apply for the CNAMB exam by creating an account or logging into their existing account. Now, if you already have an account with CCI but are unable to access that account, or you're not sure, please don't create a second account. Reach out to our credentialing team and they will work to get you into your account right away. The following information is required to complete the online application, and it takes about 15 minutes to complete that application. That information will be personal contact information, your address, home, and work phone numbers, as well as an email. And you want to make sure that you use an email that you plan to have access to long-term, because that way it'll allow you to receive timely and important communications from CCI regarding your credential. Your email will also be your login ID. You're going to want to use your legal name as it appears on your original valid government-issued photo ID. You're going to need your RN license information, the expiration date, the number, the state or states that you're licensed to practice in. You're going to need your perioperative work history for the past 2 years, the date you began working in the operating room, your current position, your current practice area. You're also going to need your employer's contact information, your supervisor's contact information, and then, of course, your payment information. You will schedule your exam online with our testing partner. Our current testing partner is PSI. And it's important to note there are testing windows, and you can see that at the bottom of the screen. So you apply in 1 month, and the subsequent 3 months is your testing window. So for example, if you applied in the month of January, your testing window would be February, March, and April. Now, let's look at the components of the CNAMB exam. These are the subject areas or domains. If you recall, I mentioned that of those 2,400 hours, a minimum of 500 needed to be in the intraoperative setting. Well, you can see by the subject areas here that 20%, the largest portion of the exam, is based on intraoperative care. Hence why those 500 hours are so important and part of the eligibility criteria. The next largest percentage is preoperative patient assessment and diagnosis at 14%. And then you can see the other percentages as well. I would also call your attention to some of the terminology here. You see assessment, diagnosis, plan of care, management of services, transfer of care. This should make you think of the nursing process. And this underscores that the exam is structured around the nursing process, and therefore you want to take that into consideration when you're taking your exam as well as preparing for the exam. Having a thorough and sound foundation of the knowledge and skills required for competent perioperative nursing practice in the ambulatory setting is important. And this knowledge can be obtained through work experiences, independent learning, and even formal educational programs. Now, each of those subject areas or domains that I just showed you are further broken into what we call task and knowledge statements. Task are what we as perioperative ambulatory nurses should know how to do. Knowledge statements is the information that we should know. And questions within each subject area are written by a panel of experts. They're written and triple checked for accuracy with the most up-to-date references. And these references are part of your study resources that we'll discuss a little bit later. And all of these come from a job analysis that CCI conducts to make sure that the exam reflects the most accurate real-life experiences. Now, the CNAMB exam, it consists of 200 multiple choice questions. And of those 200 questions, 185 are used to calculate the score. The remaining 15 questions are pre-test questions, and they do not affect one's score. These pre-test questions are dispersed throughout the exam and cannot be identified by an examinee. Now, the CNAMB exam is a timed test, and it does need to be completed in 3 hours and 45 minutes. And the computer used to take the exam will keep the official time. The computerized format of the exam does require basic computer experience. And there is an option for remote secure proctored exams, but if you elect to do that option, you will need to do a system check of your computer and your testing area prior to beginning your examination. An optional pre-exam tutorial will be provided on how to take the exam on the computer. It's going to give test takers examples of how to select answers or how to mark questions that they might want to return to and review before finishing their exam. The time allotted for completing this tutorial is separate from the actual exam time. Now, what about scoring of the exam? Well, your score is reported as a pass-fail decision scores, but your scores are determined by converting the number of questions answered correctly to a scaled score that ranges from 200 to 800, and one would need a total scaled score of at least 620 to pass the exam. So applicants need to make sure that they answer all questions on the exam, as any question not answered may count against the final score. A scaled score is neither the number of questions that you answered correctly, nor the percentage of questions answered correctly. A scaled score is transformed from the raw test score, which is the number of test questions answered correctly. And the reason for the scaled score is it allows for consistent scoring across multiple forms of the exam. So, what is the CNAMB exam? Well, it's a validation of knowledge and even skills related to current best practice. So it's a reflection of ideal practice. So we are not dealing with staffing shortages. We are not dealing with a lack of resources. We are not navigating a global pandemic. And again, it is developed for a nurse with 2 years of experience. So that's something you want to keep in mind as you are moving and working your way through the exam. It's important to know what the exam is not as well. The exam is not based on individual practice or hospital policy. Again, lack of adequate resources. So when you're looking at the questions, you might want to think not what would you do or your organization do, but what would the perioperative ambulatory nurse do? Again, based on the evidence. It is also not focused on a single surgical specialty or patient population or skill set. Now, the fees for the CNAMB exam. Applications cannot be processed without payment. So all fees or outstanding debts to CCI do need to be paid in full, and all fees are non-refundable. Also, fees are subject to change without notification, so always check our website for current pricing. You can see the price of the CNAMB exam is $375, and of course, we have the Take Two option, which gives you 2 chances to pass the exam for $420. There is a $40 discount available for anyone who holds an active CCI credential outside of CNAMB. So if you already had, say, your CNOR, you would be eligible for that discount. If you're an applicant who's been the recipient of a DAISY award, there's a $40 discount available for that. To be eligible there, you would need to provide a copy of your official award letter. And it's important to note that discounts cannot be combined. So there's only one discount per transaction. I mentioned the Take Two. During the application process, you have the option to register for that single exam take or benefit from the Take Two program. This program allows a CNAMB eligible nurse to take the exam twice within a 12-month period from the date of application if the first attempt is unsuccessful. If an individual passes the exam on the first attempt, they don't receive another exam attempt, and that second attempt cannot be transferred to another person, and it is non-refundable. It's sort of you're paying your testing fee, and you're just paying a little bit of insurance for that second take, should you need it. CCI does offer volume discounts for health systems seeking to certify multiple nurses, and you can download the CNAMB Take Two facility enrollment form from our website. Now, as far as taking the exam, you need to expect heightened security measures, much like the airport experience, if you will. It's also very limited what you can take into the testing station, so try not to take a lot of materials or items with you. Personal items that you do have will be stored in a small locker, so it's important not to bring big items like a large purse or something. You also need to be aware that there'll be multiple test takers at that testing center, and they may be taking a variety of tests. So don't let that be a distraction for you. You can also request earplugs and scratch paper if it's needed from the proctors. As you're taking the exam, it is possible for you to mark items and return to that item later should you need. There's a review screen option available, and it's not a variable exam such as the NCLEX. Again, that scaled score, you need a 620 out of 800 to pass, and you will know your results prior to leaving the testing center. Now that we know kind of how the exam is structured, let's look at some study strategies. First, it's important to be effective in your study and save time, be efficient. One way to do that is by conducting a self-assessment. That way we can build on what we already know rather than starting from the beginning. A great way to do that is to take those task and knowledge statements that I mentioned for each of the subject areas, and these can be actually located within a link in that candidate handbook. You can print out those task and knowledge statements and do a self-assessment. Where are your strengths? Where are your areas of opportunity? And then using that information, you can also access our CCI study plan for the CNAMB. This is also a free download available on our website. And it gives you some recommendations of where to read and learn more about those various task and knowledge statements. Please note that this study plan is not a full inclusive list of all you would need to know for the exam. It is just a guide or a tool. So you want to use those subject areas and those domains and those task and knowledge statements to organize your study. You might want to start with those subject areas that maybe you're least familiar, or maybe start with those that have the higher percentage of test questions. Now, as far as some more study tips, we do recommend about 3 months for preparing for the CNAMB exam. You want to eliminate distractions, turn off text messages, TV, email when you're studying. Break up the content and the time into bite-sized chunks. Some find it effective to use the Pomodoro technique when studying. You want to be able to apply broad concepts versus just simply memorizing facts and figures. There may be some information that you do need to know, and know normal lab values or maybe normal temperature and humidity for an operating room. But in general, you're going to be applying the broad concepts to various patient populations or surgical specialties. It might also be helpful to practice by taking multiple choice style exams. But we would note that it is important for you to use a variety of preparation aids. And again, that frequent review has been found to increase comprehension and retention of information. Now, understanding the test-taking process. There is a definite skill in answering multiple choice questions. Becoming familiar with techniques for responding to multiple choice questions can improve one's chance of successful performance. So let's explore some strategies for answering multiple choice questions. First of all, let's look at how a multiple choice question is structured. First, you have the stem or the question. It's important to note that the stem is going to provide you all the information you need to answer the question. So try not to add to or elaborate to on the stem that's there. That stem or that question may be either open-ended, which will kind of be a finish the statement or a fill in the blank, if you will, or it could be close-ended, which in that case, it would end with a question mark. There are 4 options, A, B, C, and D. One of those options is the key or the correct answer. It's the best answer, if you will. The other 3 options are distractors, and what this means is that they are plausible, but they are not correct or they're not the best answer. So you're always going to have those 4 options with only one correct or best answer. There are no true false or multiple multiples or calculations that require a calculator. There's no pictures, but it is important that you pay attention to key words like first, best, most, when you're reading those stems. Some common test-taking errors that we tend to see is individuals reading into the stem, overthinking, right? Using that experience beyond 2 years. Again, remember the test is designed for someone with 2 years of experience. You also want to be careful to pace yourself. You don't want to take too much time per question. Usually an average of 1 minute per question is a good target. Again, some people tend to miss that quantifier, those keywords, most, first. Changing answers to multiple questions sometimes is not best practice. If you have a very valid reason for changing a specific answer, that might be helpful. But in general, unless you have a sound reason, you don't want to be changing your answers. It's also important not to expect the same questions on the exam that were on practice exams or in prep products. Some other errors are answering questions, again, based on our individual experience or at a facility. Because a facility's present practice may not always be evidence-based or on the latest guidelines. Also, there are no tricks to answering questions such as choosing B or looking for the longest or the shortest option. Instead, what you want to do is you want to analyze the question. What is the question asking? What do you need to know to answer this question? If it's something that you're unfamiliar with as far as the content of the question, what other information could you apply, or where could you find out more information? Eliminate those distractors by being able to know why they're incorrect. So let's look at a couple of sample questions. Here's our first one. The patient population which accounts for the greatest number of eye muscle procedures is, and you have your options there. This is an open-ended question. Would you select A, B, C, or D? Well, the current answer is A, pediatric. And you see the rationale there. Strabismus correction requires early recognition and is the third most common performed pediatric procedure between the ages of 6 months and 6 years. And of course, you see the reference there, burying cones, operating room technique. Now, again, looking for those key words. Many of you likely probably can narrow down the choice to A or D, pediatric or geriatric. Again, you might want to think of outside of your typical patient population because the key word here is muscle, right? That's our key word. And that tells us that we're talking about strabismus and not cataracts. And therefore, we are focused on the pediatric population on this particular question. Let's look at another one. Question 2. The most effective way to evaluate a patient's comprehension of his or her upcoming surgery is to, and you have your options there, A through D. Again, look for those key words, such as most. This is another open-ended question. What would be your response? Well, the correct response, the most effective way, right, is to have the patient describe the procedure in his or her own words. Your rationale to evaluate understanding, we want to have the patient repeat in his or her own words what has been explained. Again, your reference is provided there at the bottom of the screen. Let's look at another question. Question 3. The perioperative nurse discovers that a sponge is missing during the closing count for a left lung lobectomy. The perioperative nurse's first action would be to, and you have your 4 options there. Now, on this open-ended question, you can see that there is a key word there, first, right? Because all of these things might be plausible. We may do all of these, but what is the first thing that the perioperative nurse is going to do? Do you have your answer? Well, the correct answer is B, notify the surgeon. And the rationale comes from the guidelines that the RN circulator should inform and receive verbal acknowledgement from the surgeon and surgical team as soon as a discrepancy in a surgical count is identified. This is where an example of where we have to be careful, where actual practice may vary from the literature. Again, we may do all of these things, and maybe you've narrowed it down to repeating the count and notifying the surgeon. Maybe in practice, you would repeat that count first because you want to make sure that you indeed have not made a mistake. And certainly if you go ahead and inform the surgeon, he or she may respond with, it's not in here, find it, and continue to close. But in theory, best practice, the evidence, we want to notify the surgeon so he or she can suspend closure and explore the wound while we also look for that missing sponge. Now, let's look at a few resources available to prepare for the CNAMB exam. Questions on the exam are based on the National Standards of Perioperative Nursing Practice, current professional guidelines, evidence-based practice. What information is universally accessible to all? And it's important to note that no single resource is going to meet all of your study or learning needs. So it's always helpful to use a variety of preparation resources. Many of the questions are pulled from these materials or resources that you see on the screen. These are the primary references. Again, if you download our free CNAMB study plan on the website, you will see some references to these materials throughout the various subject areas or domains. Again, CCI periodically conducts test development activities, and so they can develop and maintain the exam, ensuring that it is consistent with accreditation standards. So the guidelines for perioperative practice, burying cones, operating room technique, Alexander's care of the patient in surgery, and then Drain's peri-anesthesia nursing, a critical care approach. This reference is really helpful in relation to that assessment piece. And again, you always want to use the most current edition. Some optional resources might be a pathophysiology textbook, medical dictionary, or a lab or diagnostic test reference manual. Anatomy coloring books might be helpful with refamiliarizing yourself with certain anatomy if you haven't worked in certain specialties in a while. The AORN journal, AAMI standards as it relates to cleaning, disinfecting, and sterilization. And then a good drug reference manual, or maybe even Hippocrates. You may also find it helpful to use your clinical setting as a resource to study. Anesthesia personnel, your sterile processing partners, AM admission, PACU, radiology, pathology, ICU, risk management, surgeons, advanced practice nurses, woundostomy nurses, all of these individuals can be great resources to help you prepare for the various aspects of the exam. CCI has a variety of free study aids as well. Again, I've mentioned the study plan, the sample questions, we have certification coaches, and of course, our staff is always ready and willing to help. There's a variety of online resources. Of course, you see CCI's website listed there, as well as AORN, the Joint Commission, the World Health Organization. MAOS as it relates to malignant hypothermia, the Agency for Healthcare Research and Quality, the CDC. There's a variety of resources, infection control, that might be helpful as you prepare for the exam. Now, again, I must remind you of our exam prep product disclaimer that because we are a certification organization, we do not require, nor do we endorse any specific study guides, products, or courses. So you can prepare for our exams in any manner that you choose. Purchase of our materials is not a requirement, and it does not imply successful performance. But we do have some products for purchase. You want to make sure anything that you're purchasing does reference and cite current resources. In our store, there are products such as a Pocket Prep app, an on-demand prep course, but again, not required and certainly do not indicate an advantage to successfully passing the exam. If you have any questions, please reach out to our credentialing experts. They are eager and waiting to help you. You can see their contact information here. The email is info@cc-institute.org. And then, of course, here are the emails for the education team at CCI. We wish you the best of luck as you prepare for your CNAMB certification and look forward to celebrating with you upon your success. Thank you for your time and attention.